Many of our older patients prefer shockwave therapy over more aggressive soft tissue treatments because it causes less soreness and bruising, especially for those on blood thinners. Shockwave therapy is particularly effective on chronic tendinopathies such as lateral and medial epicondylitis or rotator cuff syndrome. It works in a couple of ways. First, shockwave breaks up fascial adhesions or scar tissue that may have developed in the injured area. It also jumpstarts the healing process. One of the reasons that injuries become chronic is that the healing process becomes stuck before it has progressed through all three phases: inflammation, proliferation, and maturation. During the proliferation phase, the body sends fibroblasts to the area to create scar tissue. The purpose of this scar tissue is to act as a sort of internal band-aid to protect the area from further damage. If you were to look at scar tissue under a microscope, you would see that collagen fibers go in all different directions, which is very different from healthy tissue, which the collagen mostly goes in the same direction. The scar tissue can form more quickly than healthy tissue, which is why the body produces it during this intermediary stage. However, it is not as strong as type 1 or 2 collagen in healthy tissue, nor can it move in the same manner as healthy tissue. By breaking up this scar tissue with shockwave therapy, the body recruits more repair cells and sends them back to the injured area to produce healthy collagen in place of the scar tissue. You may notice some swelling or redness after a shockwave treatment. This is the body's way of jump-starting the healing process again, and it usually disappears within a few hours or a day after the treatment. The intensity of shockwave therapy can be adjusted to ensure it is always comfortable. It should not hurt. Muscle and tendon injuries frequently feel immediate relief and improved range of motion within a few sessions. We can use shockwave early in treatment on very tender or painful injuries because it is more comfortable and produces less soreness post-treatment than Graston or any instrument-assisted soft tissue treatment. Patients often think all injuries heal the first time, but it does make sense that their chronic injuries are composed of zones of tissue that didn't heal the first time and have now become chronic sources of pain. Aggravating the poor healing scar tissues forces the body to restart the healing process. Soft tissue injuries often respond quickly to shockwave therapy, providing immediate relief and improved range of motion. Visit our website to learn more about shockwave therapy and how it can improve your function and help get rid of your acute and chronic tendon and ligament injuries.